automation opportunities that are there in the PV spectrum. And pardon me, I'm using PV as the acronym for pharmacovigilance. And so with that, I will also talk about in the general landscape of PV. Right, it starts with sort of ingestion of information. Right, there's information that comes in from various sources. It comes in from the files. It comes in from emails. It comes in from faxes. It comes in from calls. It comes in from call centers. It comes in from, as I said, social media streams. It comes in from very specific patient reach out programs where people, when they launch a drug, they reach out to the patient and see how they are behaving against those drugs. So those are various ways you get cases. And then, of course, those cases have to be processed, which includes a lot of medical intervention to make sure that primarily trying to assess if this case is actually caused. Case is really a side effect. That's the terminology we use. Now, is this the case actually caused by my drug? That is the fundamental assessment you're trying to do here, and that's called causality. When you do that, you write narratives, and there are follow-ups, etc. So that's a case processing piece. And I will not sort of go into the deep details here. So the idea is to just kind of tell you at a top level what are the various phases in the PV space, and what are the opportunities that we are seeing right now, and how we're using technology to address those opportunities. So case submission is the next thing, wherein while you have these cases have to now go to the relevant authorities. So the authorities are the various regulatory bodies in various countries. There's FDA in the US, the Drug Controller General in India, and so on. That's the distribution and submission part. And also then you have to sort of use the analytics and signaling pieces, where that data, there's a number of compliance oriented reporting that needs to happen, and that reporting is largely in two sections, right? One is expedited, which is you get a case, you report a case within a certain time frame. The other is more aggregate, so you get a case, but then you sort of consolidate number of cases over a period of time and report in an aggregated fashion, and that's the aggregate reporting piece, which we deal with. So there's tons of reporting that happens, and there's tons of data to analyze from. So that's where the whole analytics engine comes in, to see what's going on with the data and make sense out of that. Like I talked about signaling on the right side, is it's all about assessing signals from all the noise that you have outside. So can you detect the signal? Can you evaluate the signal? Can you prioritize the signal? And can you actually report the signal? These are the tools that again are coming in, the number of algorithms that are in place for signaling and making sure that you are able to understand and make sense of all that you see around. So the opportunities for automation and opportunities for technology, as you can see, and this is true for any industry, right? It is true for. It's just that from a pharmacovigilance perspective, from a life sciences perspective, we tend to be a little bit more conservative in our approach to technology, and so all these areas are very ripe for interventions from a technology perspective. In Ultragenic, we have looked at the space and have looked at what technology interventions can happen across the spectrum. And the orange dots really are talking about areas that we are influencing today with our tech.